So, okay. Okay. Thank you. Good morning, Namibia and the world, and welcome to our morning session here at the Government Information Center. Today, we're looking at a topic that is very pertinent, especially to parents out there. It is the National Integrated Vaccine Campaign that is being launched. In the studio, we do have two panelists, but I am Shianwa Desire Kahiha, and I am your moderator for this session. To discuss this topic with us, we have Mr. Nicolaus Shapumba. He's the National Immunization Program Officer with the Ministry of Health and Social Services. Good morning, sir. I also have returning to my hot seat Ms. Rosalina De Vere, and she's the immunization officer for the World Health Organization in Namibia. Good morning, ma'am.
Good morning, Desiree.
It's nice to see you again.
Likewise.
Kicking it off, very simple. The Ministry of Health and Social Services has scheduled to conduct a national integrated vaccination campaign. Mr. Shapumba, please take us through what the campaign is all about.
Yes, thank you for having us in the studio today. As you rightly say, we will have an integrated vaccination campaign starting from the 8th to the 19th of August 2022. So the integrated will be about a lot of things. We will vaccinate children under 5 years. All the children under 5 years will be vaccinated with measles and rubella vaccine. And then we will also look at the routine vaccination. We will be screening children that might have missed a dose or two of routine vaccination, and then we'll vaccinate them accordingly. We will also give all the children under 5 years the vitamin A supplementation, and then we'll also give the children from 12 months to 59 months, we'll give them albendazole, that is a medicine for the women. And otherwise, we also look at the women of childbearing age that might have missed a dose of tetanus toxoid vaccine, and then we'll also vaccinate them accordingly. And in addition, we'll screen all the children for nutritional status. So, and if they are found to be malnourished, so we'll treat them, but those are severe malnourished, we'll refer them to the hospitals for further treatment. So, in addition, we'll do also vaccinate against COVID-19. So, those who are not vaccinated, please make it to the vaccination point to get your dose.
We stay with you, Mr. Shapumba, because I want us to have clarity. Integration has many different meanings, and we want to make sure that our nation out there gets the right meaning in this context. So, what do you mean by integration, integrated in this particular context when we come to vaccination?
Okay, if you may recall, we have a routine vaccination program. Okay, that we were targeting the children under 5 years, we are vaccinating them at a facility and outreach points. So now in this case, we will have also now the campaign itself targeting all under 5. So, and then we have COVID-19 vaccine. So we are integrating all these interventions, including the one I mentioned about vitamin A supplementation and the deworming, but also now screening the children for nutritional status. So we are integrating all these interventions in one go.
Okay. Coming to you, Ms. De Beer, we want to know in general and also from the WHO perspective, what is the significance of the integrated vaccination campaign?
Thank you, Desire. Yes, it's a very good initiative because you are bringing services together at one point. And that's why we are really for the integration. So you don't need to now go and do, for example, do a measles rubella campaign this month, and next month you go and say, okay, all the children that have missed the routine vaccinations, because we all know that during the COVID pandemic, maybe parents could not bring the children, maybe the health facilities were also overwhelmed. So many children really missed. So that's why the integration is trying to bring everything under one umbrella. So you go once and all the services will be provided.
Wow.
Thank you.
Okay. We stay with you, Ms. De Beer, and in the same vein, can you also speak to us about the importance of growing integration immunization programs?
Yes, you know, when we started COVID vaccination, it was standalone vaccination sites at various points. But going forward, it's really important that it just become part of the routine services already being provided. Because it's the same health worker that is providing the COVID vaccination that has to go back and provide again routine immunization. So in view of this, and COVID is not going to go away anytime soon, at least for the next couple of years based on the science. So it's better that at the facility, all the services will be provided, including COVID vaccination under immunization program.
Okay. Mr. Shapumba, the National Integrated Vaccination Campaign entails a lot of vaccination categories. Please state them and take us through the eligibility criteria.
Okay, like I said, so we have, for the measles, we have a measles and rubella vaccination campaign that we are targeting all the children under 5 years. We're actually starting at 9 months. The child that is 9 months until 59 months. So we will be given measles rubella vaccine. And while the children that are also under that age group, we will screen them. So for routine, if they might have missed a dose or two. So instead you go to the passport and then you check if they are up to date with their vaccination status, and if you find that they missed a dose or two, you vaccinated them. So this is now routine. But you also will also look at now the women of childbearing age. So remember, they're supposed to get a tetanus toxoid. Now we call it a TD, tetanus diphtheria. So we also screen them, and if they need a dose or two, we will also give them. Pregnant women also, if they turn up and then they need a dose of diphtheria and tetanus, they will get, but also the pregamal supplementation, iron folic acid supplementation, we also give them. And now your COVID-19 vaccine, of course, so we will give those that are coming up to and they need to be vaccinated. So we will screen the children for nutritional status. So we measure them, we do what we call the MUAC, the measurement of the upper arm circumference, where we will determine if they are malnourished or not. And if they are found to be malnourished, we will give them the treatment. What we call therapeutic treatment.
Yeah.
So we give them right there. And if they are severely malnourished and they need to be admitted, so we'll refer them to the hospital for the treatment.
Okay, okay. No, that's definitely very clear for us, Mr. Shapumba. Thank you very much. We'd also like to remind you that you're very much welcome to add your voice to the conversation through the platforms that we are streaming through. On our Facebook page, you can find us at the Ministry of Information and Communication Technology, Republic of Namibia. That's the Ministry of Information and Communication Technology, Republic of Namibia. You can also find us on our YouTube platform. That is MICT Namibia. That is our handle there, MICT Namibia. If you have any questions, we are also very much welcoming your calls into the studio. Our area code is 061. The number is 400-397. 400-397. Ms. De Veer, the next question we would like to address to you, and we want to know from you, what do we intend to achieve or address with this particular campaign?
Thank you. I think Mr. Shapumba already mentioned that who are the target groups, and you have also asked who are they eligible. So for the under 5, we intend to reach every single child from 9 months till 59 months with the measles and rubella vaccine. And this is very important because we have noticed and we have seen that quite a number of children did not come back for the second dose of the measles rubella vaccine. And that's the main reason why we are giving an opportunity to every child in that age group to get a second chance to get the measles and rubella. So that's what we intend to achieve first for measles and rubella. Then for the routine vaccination, to find all the children that we have missed for whatever reason and give them opportunity to give them the polio, the pneumococcal vaccine, the rota vaccine. You know, there's quite a number of vaccines that they've missed. So that once, we are not just going to give to every child. We check in the health card. If they're updated, no problem. We will just give them the measles rubella vaccine. So we intend to try and achieve at least 100% of the children in under 5. And then COVID-19 vaccination, you know our coverage is very low. So from the Directorate Primary Healthcare side, under the leadership of the director, we are trying to really see, can we move from where we are to at least 50%? We are one of the countries that is not doing very well when it comes to what percentage we have achieved so far for COVID vaccination. So this is an opportunity. The services are brought closer to people. There will way more sites. People will be having teams that maybe we didn't reach every corner of the country, but this is an opportunity to try and really reach every corner in the country.
We applaud your institutions for trying to do that, because taking the time frame that we were in from 2020, 2021 was no different. People were really scared of going to medical facilities. People were confused also. So I would understand that a lot of children missed their vaccinations, especially the children. I would trust a lot of them missed those points in their vaccination cards. Can you, I think this I would like to pose to both of you. Can you please take us through the process and procedures on how the campaign is going to be conducted? We'll start with you, Mr. Shapumba.
Yeah, how we are going to do it, we are going to implement different strategies. So teams will be deployed in the hard to reach areas and in the villages and in the outreach. So actually we will have, like I said, strategies which will be, the vaccination will be available at the fixed strategy, which will be your health facilities. All the health facilities across the countries will be vaccinating. But then you will have now what we call outreach, where we'll have teams going out to identified places where they will be staying like the whole day or the 2 days, vaccinating, that will be outreach. But then we also have teams that will be moving around. We call them mobile teams. They will go to one place and maybe stay for some hours. They move to a next point, and then they spend the whole day there. So those are the strategies that we are going to employ. You may also be at some places like the mall, if you are in a mall, so then they can bring the children at the mall, shopping centers, wherever the situation might be in that particular locality. So that will be throughout the duration of the campaign from the 8th to the 19th. So we hope to get everybody there. So teams that are for like in areas where you have places like in Opuo, where you have people staying behind the mountains, so we'll make sure that we'll also send teams to go and vaccinate those children that are in those hard to reach areas.
Okay.
Yeah.
Do you want to add anything on that, Mr. Veer?
Yes, indeed. Maybe just to say that in addition to that, this whole process started with what we call micro-planning, simply meaning that narrow down to the lowest level of service delivery, so that we exactly do what he's saying, that you know exactly this population, what do I need to do to reach them? He mentioned already Opuo, some areas, they might need, or not they might, they will need a helicopter, so to make provision for that. So it started from that process of planning, because the regions and the districts, they sat together, they came up with a plan, and that's how we came up with an integrated plan for all the services, which they presented to us about 3-4 weeks ago, where you are costing everything, human resources, transport, etc. But that is the guiding document that says, okay, this is how the teams will move, because they have done this before. So it's not the first time we are doing a big campaign. If you might recall, 2016, we had an MR campaign, measles rubella, for a wide age range, up to 39 years for that matter. And that also involved a lot of careful planning, because whenever there is an injection involved, it's always more planning that goes into it. So it started with that process of involving the lower level at service delivery. Thank you.
Okay. No, I like the fact that Mr. Veer mentioned a helicopter, because my question was then, have you considered, or did you include, for example, other stakeholders such as your NDF and so on, to try and assist in elements like those, especially with regards to very, very deeply remote areas like the Kunene region? Mr. Shapumba.
Sure, yes, so we have done that, and during our micro-planning that we had 2 weeks ago, like Mr. Veer have explained, we had the stakeholder with us. We have the development partners with us. We have all other stakeholders, our CDC people, UNSID, also our NAMPOL people, and the NDF. So they are all part of the stakeholders. So they are even part of the teams that will do the supervision, and they also availed their vaccinator to be part of the team that will do the vaccination campaign.
Wow.
Yeah.
I like the fact that it's a large group of stakeholders, and they're really coming to the table strongly to try and make sure that this particular campaign is a huge success, especially where you're also talking about them having to avail their own vaccinators or immunizers as well.
Sure.
Are there any activities prior to the campaign that are taking place? If yes, what are some of these activities, Mr. Veer?
Perhaps Mr. Shapumba can start, because we are planning a very big launch.
Okay.
But I'll give the floor to him on Wednesday.
Yes, before the launch perhaps, of course, with any other activity that you're undertaking, so you have to do the training. So already the region and district have started with the training of healthcare workers, just to take them through the processes, so that they know what to expect during the vaccination campaign. We will also have at national level, we will have a team of supervisors that will go out and supervise the campaign. So they will also be trained. We'll take them through the processes on what they are going to look at and what they are going to supervise and where they are going and all that. Now, the other activity, of course, the mobilization of our community that have started already. Some districts have started last week, and then they will go through this week. So we are engaging all the stakeholders, the communities through the leaders, political leaders, community leaders, church leaders, NGOs, whoever is available in that localities. So they are part of the target for mobilization. Now, the big one will be the launch, and the launch will be this week, the 3rd, which will be on the Wednesday. It will be at UN Plaza, and the Honorable Prime Minister will do the launch. So that will be the national launch. Of course, after that, you may have regional governors that will also like to do the launching in their regions. So they will also have an opportunity to do the launch after the national launch by the Honorable Prime Minister.
Okay, okay. That sounds good. It sounds that you guys have been busy, actually.
Very much. It's hectic.
Have you had any sleep for the past 3 weeks, I think is my question.
Sure.
Oh, shame. I think there's also one question that I would actually like to address here. You spoke about earlier on, Mr. Via, you referred to checking the immunization cards, and on the basis of where the child is on that card is where the immunization next step will be taken. But now, should a parent or caregiver not have this card and not necessarily be sure of how far this child has gone with regards to their vaccination, what should a parent or caregiver do if they're not sure of whether the child's vaccination is up to date or not?
We definitely encourage them to still come to the site, and typically what the health worker will do is to try and ask questions to the best of the caregiver's ability to remember, and the child will be issued with a new health card. That's normally what we do, and based on the age of the child, they can now make a decision should the child be vaccinated or not. But just to say that even if the child receives another dose of, for example, polio vaccine or one of the others, the pentavalent vaccine, which is having your whooping cough, etc. in it, it's not a problem. It's probably a good thing, because, a child typically needs at least 3 to 4 doses of that particular type of vaccine before you are really fully protected. So they will be issued with the card, and and then of course ask questions to the caregiver, and then based on that, the child will be provided with the doses based on how old the child is, because we have the schedule 10 weeks, 6 weeks, 14 weeks, 9 months, etc.
Okay. We all know that activities, campaigns, and so on, they come with their challenges and sometimes also risk. So at this point, we would want to know, what are some of the challenges you are anticipating, and what mitigating factors do you have in place to address the said challenges?
Interesting.
Yeah.
Challenges, you see, it's a massive operation, like we said. Of course, we have done some homework regarding mobilization. I don't want to believe that there are some corners where this campaign is not known, that it will be coming to their doorstep. You may have some challenges, operational challenges perhaps, especially where you perhaps not be able to reach at the point where you wanted to reach. But we will, like I indicated, we have already done the mapping, so we know where we should go and how we should get there. So, and we are also looking at where we do not have enough transport for the government will also employ community vehicles that will support the teams to reach where we have planned to reach. Of course, things like in COVID vaccine, you know, our anti-vaccine group, so you do not want to ignore that. They might come out and say, no, don't do this and that, but we have our strategy to tell. We have information that are sent to media, we have some advert, we have all this just to clarify the issues of COVID-19 vaccine and what people should not believe and all that. Okay. So those are the actions that we have in place.
Okay. No, well, at this point, we are rounding off our program for today. Mr. Veer, any last closing remarks that you'd like to make?
Just again to appeal to communities, you know, that we do the responsible thing and get vaccinated. I think I mentioned already that we are one of the countries with the lowest coverage against COVID vaccination. So this is really an opportunity to use, to go to the sites, and then also the similar for the children. We have had earlier on in the year, which I think it's known, we had some few confirmed measles cases, and that's a direct impact of the children having missed vaccination. So we don't want to go, you know, forward in this year seeing other outbreaks of other vaccine preventable diseases. You know, at this moment, some of our, although not direct neighbors, for example, Mozambique, Malawi, they reported wild poliovirus, which we haven't seen for a long time. Again, it's just because the immunization program was really impacted by COVID, because I think you mentioned already that at that time, even caregivers didn't want to go to the facilities. So just really use this opportunity. It will be close to you. We will try our best to make sure that services, we always say try and bring the services closer to people. So this is what we are trying to do. So really just to encourage each and every Namibian to get vaccinated. Take the children, you yourself, when you're at the site, so it can be, that's why we call it an integrated services, so you don't need to go separately, it can just be under one umbrella. Thank you.
Mr. Shapumba, with your closing remarks, can you just remind us about the details of the launch?
Yes, the team it's on the ground already making the final touch to the launch. Like I have indicated, it will be on the 3rd of August, and it will be at the UN Plaza. It will be starting at 9:30. Okay. So please, I'm inviting everyone to make way to the UN Plaza. The Honorable Prime Minister will be the main speaker. Okay. And of course, we'll also have our own Minister of Health, Dr. Shangula, and the management as part of the launch. Okay. And then, of course, after that, of the region can now chip in, the regional governors, of course. Yeah. They will do the launch also in their respective region if they choose to do so. Yeah. Yes.
Okay. Thank you very much to our panelists who availed themselves to come and inform us on this very important campaign that is being launched, as Mr. Shapumba said, on the 3rd of August. And the campaign will kick off in full force on the 8th. I believe that will be on a Monday. Yeah, on the 8th, which will be on a Monday. That's when the ground runners will start doing their thing. Please make sure that if you have missed or if you are doubting whether or not your child has all the necessary vaccinations, please do make your way to these points. If you're pregnant, please do go to these points. If you've had any other, as an adult as well, if you have had vaccinations that you missed at some point and you're worried, you can always go and inquire and make sure that you get the right information. This is what this campaign is for. Making sure that we root out the doubt, making sure that we vaccinate and we update our vaccinations for our children through to our adults, inclusive of the COVID-19 vaccine. Thank you very much to my panelists for making their time to be with us. Thank you, the audience, for being part of our program today. From myself, Shianua Desire Kahiha, along with my production crew here at the Government Information Center, we will see you again this afternoon at 3 o'clock when we deal with another pertinent topic to the nation. Bye-bye.